In the horse world, we hear joint health, joint inflammation. The term joint just in general is thrown around a lot. But from a rider, a competitor perspective, we honestly don't usually know the science of what's happening in the joint. From your vet perspective, when we're throwing around the term, joint inflammation, what is actually happening inside the joint?
Oftentimes, things are happening inside the joint long before the horse shows it. And typically that's because there is subtle inflammation within the joint. And when we think about joint disease, we should think about it as the whole joint, not just the cartilage. Oftentimes people think about just cartilage wear and tear, but we've got to think about the synovium, which is the lining of the joint itself, the joint capsule, the cartilage within the joint, the fluid within the joint. And each of those components is susceptible to inflammation or can show signs of inflammation with some of the chemicals or proteins or factors that are within those structures. So oftentimes there's a quiet whisper within the joint that riders will feel and describe as a horse just not striding out, or it's taking longer to warm up, or some of those subtle signs before we really start to see the clinical signs at the vet hospital of heat or pain on flexion or lameness.
I think if we just take a really broad approach and think at a high level first, we think about the joint being healthy, and it really is a reflection of the body's amount of inflammation. There are some horses, there are some people that have a lot of inflammation in their body, and that can be due to illness, it can be due to disease, it can be due to nutrition, it can be due to environment, and it can also be due to injury. We have to think, is there a joint issue, joint pain going on with this horse due to a local joint injury or a developmental problem within that joint? Or is it, again, a reflection of whole body inflammation? And really, the more joints affected, the more you start to think about whole body versus, one acutely affected joint where the horse has been performing well and then, shows up with an enlarged fetlock joint. Thinking broadly that way, I think is helpful for people not to get just too focused on injuries, but to consider the overall amount of inflammation within the body. I think that's frequently overlooked and maybe discounted in a way that I think it is important for people to realize. And the joints are just kind of an area where that inflammation begins to slow down. The blood flow slows down, and sort of those things that cause inflammation begin to stagnate in the joint. And then the joint becomes sore, painful, and it can be, as Keith said, just a very subtle whisper, but it can also escalate to quite severe lameness, even when we're talking about something as broad as total body inflammation.
Y'all both mentioned some of the things we'll feel or how they show up different in each horse. Like it might be a shorter stride. They might just feel a tick off. Sometimes I notice that a horse doesn't want to, stay in their stop. They might feel choppy. If we ignore those signs long-term and we're not really acting on the inflammation and the joint health, what does that look like for a horse's career if we ignore those signs?
Yeah, I think left unchecked, those have a pretty significant effect on a horse's potential and career. There are studies out there that say that horses overall, 60% of horses will experience osteoarthritis or arthritic change in their lives. And we also know that is the main cause of horses having downtime or being out of training. So when we ignore some of those whispers, they become compounded because osteoarthritis is created by subtle change over time. And so if we think about the forces that a horse puts on its joint while it's performing athletically, take the ankle or fetlock joint, for example. A horse that is bearing full weight on that fetlock as it's about to break over puts about 4 to 5 times of its body weight in force on that ankle joint itself. I mean, that's massive shear and strain and compression on that joint. And so when we're asking an inflamed joint to do that over and over, it's just not able to repair and keep up with the demands on that joint. So we start to see more severe signs of arthritis, and those are pain on flexion, those are lameness, those are heat in the joint when we run our hands down the front of the joints. And it's so much more difficult to repair that than to address it early on in the horse's career and really support that joint in a healthful way all the way through that athletic career.
From a clinical perspective, I think that it's another really good reason to know your horse well, and to know the baseline of your horse, and to know what all the joints and the tendons and the ligaments feel like. If you part of your normal sort of tacking up process, grooming process, is to truly go over your horse's legs from the shoulder down to the foot on the front, and from the hip down to the foot on the hind, and just getting really in tune with how your horse feels, where there are swellings, where there are fluid accumulations, where there are bumps and scars, and then in heat, and knowing what's normal. It just allows you to detect those problems. Keith spent a lot of time working on the racetrack, and I think I'm speaking for you a little bit, Keith, but I think that those grooms that take care of those horses every day, they are so attuned with those horses that they can detect the most subtle new swellings and little bits of heat and just changes from day to day that really help that horse person to raise up a flag and say, hey, I need to get a veterinarian in here to examine this horse because there's something out of the norm. So I think that is really good advice for any owner, to learn exactly what's normal, and so you can detect those subtle abnormalities, and we can go in there clinically and evaluate those before they do escalate into something like arthritis, which is really a downstream effect of wear and tear, which everyone thinks about. It can be traumatic, meaning a sudden massive injury that causes so much inflammation it leads to arthritis. And then that arthritis tends to be progressive. So if we can stop the inflammation from occurring, then that's going to stop the arthritis from developing or from becoming worse if it has already developed. And a lot of times beyond the clinical exam, we also use things like x-rays, computed tomography, which CT, and even MRI to help detect both subtle and sometimes very catastrophic and chronic arthritis. So that's another way that we evaluate those joints.
That's a great tip that all horse owners, I love a takeaway that we can do on our own, and being comfortable with our horse and knowing their legs, knowing what feels slightly off. Sometimes when we talk about joints, the first thing that comes to our mind is injections, therapies, what can we do? And when it comes to supplements, where does that fall in the spectrum of care, both for the horse that we're trying to be proactive with and prevent joint issues in, but also that older horse that has already been injected, they're already seasoned, they already have had joint issues? Where does supplements fall for both of those horses?
Well, I'll start with just speaking again to the total body and inflammation. I think that I've worked in a variety of breeds, and some of these horses are challenged nutritionally more than others. So, there's a lot of great ranch horses that get to spend time out on good pasture. Their majority of their energy comes from good forage, and they're supplemented with concentrated sources of calories like grains and pellets in a very small way. And I think that the good thing about pasture and having a forage first is that it really allows the horse to have a natural accumulation of fatty acids. Everyone hears about things like omega-3 fatty acids is those being sort of anti-inflammatory and beneficial. And they really are, but it's not just the provision of omega-3 fatty acids, which are naturally found in fresh forage, which makes fresh forage so healthy for horses. But it's more about the ratio of the omega fatty acids that the horse is consuming. So whenever we add a lot of concentrated grain sources, especially grains such as corn, that throws off that balance of the omega fatty acids. And we're typically talking about omega 3, 6, and 9. And some of those are pro-inflammatory, so they cause inflammation or allow inflammation to occur. And some of those are anti-inflammatory. And so if you have that ratio disturbed, even if you're supplementing something like flax or a form of omega-3 fatty acids, if you don't have that ratio conserved in the right way, then that horse is going to have more inflammation in it. So I think when we first talk about supplements, I always like to first talk with nutrition. A great case study in terms of a breed and discipline that really overfeeds their horses a lot is the halter horse scenario. And the halter horse is there to be really showing off its musculature and its and the way that the horse is put together. And those horses get a lot of concentrated feed, and they don't exercise a lot. There's not a lot of wear and tear. They're not running a lot of patterns. They're not cutting, doing a lot of lateral movements. They're not speed horses that are breezing for miles on end. So, you don't have that athletic pressure, but you have a grain pressure, and those horses will develop tremendous arthritis just by sitting in their stalls due to the amount of inflammation due to their diet. So let's first always start with diet. And then as we talk about the supplements and we've got the diet normalized, I think the supplements is another place that we can really try to minimize inflammation by feeding certain supplements that are known to decrease total body inflammation. And one of those that I'd like to point out is a postbiotic, which is included in the 4-6's joint supplement. The postbiotic is something that helps condition the gut. We know that the gut is massive in the horse. They rely on it for so much for their energy, but they also rely on it as a regulator of their immune response. Well, the immune response is basically where inflammation comes from. Inflammation is part of the immune system. So if we can keep that gut really healthy, studies show that the amount of inflammation in the whole body goes down. And by the provision of these postbiotics, we actually measure inflammation in the joint before and after supplementing with these postbiotics. And the inflammation in the joint, by feeding a GI supplement, a postbiotic, actually reduces the joint inflammation. So that is a really critical thing for people to know and to understand. I think it's widely unknown amongst most horse people how important it is for us to minimize the inflammation in the gut in order to minimize the inflammation in the joint. So there's a gut joint axis that really has to be understood and has to be supplemented and supported. And the ability to provide postbiotics that knowingly do that, and then the prebiotics and the probiotics that GI supplements can also provide, can also have a way of reducing that immune response in the gut, which translates to less inflammation in the joint.
Yeah, I think it's important to tag along with what you just said about whole body inflammation, because what we often see is with that full body inflammation, the complaint that a horse owner comes into us as veterinarians with is the joints are puffy or the horse is lame. And it's really interesting. There was a study on horses that were fed specifically the postbiotic that we have in the 4-6's joint support product, that Saccharomyces cerevisiae fermentation product. And then those research horses had something injected into their joints that causes inflammation experimentally. And they found that the horses that were getting the postbiotic had significantly decreased inflammatory mediators in their joints. So they actually demonstrated that direct gut joint axis and how correcting nutrition and supplementing nutrition can have such a positive effect on joint health. And so if we think about that as the foundation for overall holistic joint health, and also think about how we traditionally have treated osteoarthritis, maybe we would inject a joint with hyaluronic acid to support the fluid in the joint. Well, we've only supported one component of that joint with that injection. Maybe there would be a corticosteroid that's added to that to create massive anti-inflammatory action. Well, perhaps we can do that in a different way by supplementing some of the components that are within the joint support product. And so thinking about it, supporting those joints holistically versus symptomatically, when they get to a point that they're screaming and saying, I need to be treated so I can be serviceably sound, really going from the other end of it and saying, how can we have an effect, a positive effect on the athletic longevity of the horse by supporting it nutritionally first, And then if we get into a situation where due to injury or due to an incredibly demanding athletic schedule or something, that we need to do something directly to an individual joint or for an individual joint, when we think about those forces that are put on the joints, oftentimes we do have to come in and individually treat a set of hocks or treat a fetlock so that that horse can perform at its level. But that's how I think about the whole body inflammation versus joint inflammation, why the postbiotic, and many of the other components that we added to the 4-6's joint support.
As a horse owner, we're constantly flooded with supplement options. And so it's hard to discern, is a supplement working? How do we judge it? So when it comes to, our supplements and our joint supplements, as a person, we can feel the difference. When we're taking a supplement, we feel better, we don't feel better. In our horses, what are those things we can look for, or how we can judge if a supplement in our routine is working, and how long should we give a supplement, the ability to work?
What supplements can work on their horse to minimize inflammation, to improve joint mobility and comfort. And in addition to the postbiotic, I think it's also important to consider other natural inflammatory processes. So much of what we think about with a joint supplement is just trying to put building blocks back into that joint. So making sure that the joint has all the nutritional components that it needs to repair and maintain a joint. So that is traditionally how joints have been supplemented. People think about there being hyaluronic acid in there. They think about things like glucosamine. They think about collagen. Those are substrates for a joint to repair itself. And those can be important to supplement because if the horse can't make enough of those on its own, that can lead to problems. But the reality is that that's just like the very scraping the surface of how we really supplement that joint. So yes, I consider many of those ingredients to be sort of core joint supplement ingredients, but the idea of just providing the body a set of Legos to repair itself is a bit short-sighted, and we really need to call out the things that we can do to really help that joint stay healthy. The more time that a horse has inflammation in his joint, the more that arthritis is going to manifest, and it's going to be a permanent change. Once arthritis sets in, arthritis doesn't go away. So our whole real idea about supplementing a joint is to suppress inflammation. So we talked about doing that with conditioning the gut and having the gut joint axis to be in check. We talked about minimizing the amount of omega fatty acids, the bad ones, and making sure that ratio is right. But there's also a few things that you can do that are natural anti-inflammatories, something like boswellia. Boswellia is a tree bark that actually can be fed to the horse. And actually that anti-inflammatory, it's almost like an aspirin-like property that bark naturally has. Well, that can go in and act locally at the joint by feeding that innerly. That particular supplement can go and reduce inflammation in the joint. There's another one that is well known, acetyl-M, and whenever that is supplied in the right format as well, that has a natural anti-inflammatory process for that joint. So I think when people think about supplementing their horse, they need to be thinking about forage. They need to be thinking about maintaining the right omega ratio. And then I think they need to think about minimizing inflammation through natural ways, postbiotics, boswellia, acetylmyristolate. And then they need to think about the building blocks, the Lego pieces that help the joint repair itself. But they need to think about all those things. They don't need to just think about, hey, we're going to feed this by adding some hyaluronic acid or some collagen. My horse is going to have a healthier joint. True in a small way, but really the key is to minimize joint inflammation. So
yeah, I love that you're putting it as a whole system approach, because I do think, we've talked about this a lot. We get honed in on singular focus instead of approaching it as the whole system of the horse. And so from your perspective, Dr. Keith, how do you judge, what in your routine, like a supplement, is it benefiting or is it just fluff in your routine?
One of the important things to me to remember when I'm talking about supplements with a horse owner or a client is that oftentimes what we see first is normalizing the inflammatory process. So when we start to put out that fire of inflammation, the lameness starts to improve. That's when we see marked improvements. And oftentimes that happens before we start to see the real health of the joint start to respond to supplementation. So we may see an effect in the first 14, 21 days from the inflammation starting to quiet down. And oftentimes that supplementation has started at the same time that there's a little bit of bute given or a little bit of banamine given. And so we really are suppressing with pharmaceuticals and with the nutritional supplements that inflammatory process, where we start to see the real benefits and the riders start to feel the real benefits with the horses having the propulsion from behind that they used to, or they're striding out, or they're not drifting out like they were when they had the issue. That we may not see for 30 or 60 days if we're looking at supplementation alone to offer that. But that's when we know that we're onto something, is that the rider is starting to feel something, and incrementally that performance and the horse's own trust in its own equipment, its own self, is starting to improve as it makes those runs.
And I think it's also important as people to think about how long do we supplement? When do we supplement? I think those are, this is not something that we typically treat like a course of bute that your vet may recommend, right? That's going to be a course that you're going to give. We're going to start today and you're going to stop today or on a certain day. And supplements are not the same way. When a horse has a demanding athletic schedule, it needs to be on a joint supplement all the time. You do not want to wait on that inflammation to start. You need to be controlling its diet, its omega-3, 6 and 9 ratios, and the joint supplements. You need to be doing that now, as soon as the horse is in training and all the time while it's in training. Because the idea is not to suppress inflammation once it's occurred. The idea is to minimize the occurrence of inflammation. And that only happens when you take a proactive approach, which accomplished horsemen recognize. They've dealt with these issues because they are performance and sometimes career ending. And so they know that they have to play that game of offense and being proactive with using these supplements and managing the diet. So once that horse is in training, it's started on joint supplements, it remains on joint supplements while it's in training. Now, if that horse is able to get an extended layup period and where it can be turned out onto good grass and it's not going to be in athletic training, well, that would be a fine time to stop the supplement while the horse is being laid up, assuming that you don't have any chronic joint issues going on. If you do, that chronic joint issue, even if the horse is not exercising, is going to be producing inflammation. So in those situations where you have a horse that has a chronic injury or anything that's creating inflammation, even when the horse is not exercising, those horses need to stay on joint supplements the entire time, 365 days a year. And we typically see that with our older horses, the horses that have gone through years of training, lots of showing, lots of rodeos. Those horses need to stay on it for the rest of their life. So the key takeaway is that I would say is that you've got to give these things time to work. They work slowly, but they work in the long run. And you've got to continue using them while the horse is in training, or if the horse has any chronicity, they need to be maintained all the time. So that's not just a short-term treatment. It is a long-term wellness plan for that horse to preserve its athletic career.
If we think about it with this simple mantra that soundness is so much easier to protect than it is to recover, then this all makes sense. If we think about it as fighting a fire as the grass fires pop up, then we're just playing a game of whack-a-mole, and we're already way behind.
We've talked about some of the ingredients that are beneficial to horses, but in the 4-6's joint supplement, what is the specific breakdown? What makes up the formula?
The total formula is the postbiotic. Postbiotic is a fermentation product from a yeast, so Saccharomyces cerevisiae fermentation product. We've also included some of those building blocks that we talked about before, things like glucosamine, chondroitin sulfate, hyaluronic acid. Then we provide some of the crucial minerals that are essential for joint health and minimizing inflammation in joint health. That's going to be things like manganese, zinc, copper, cobalt. All those are critical. If we know that horses can't repair themselves if they have any of those mineral in short supply in their diet. And then we start thinking about the natural anti-inflammatories that we can feed these horses. And that's where we're going to hone in on things like the boswellia, which is a tree bark that has natural anti-inflammatory properties. And then cetyl myrtleate, which is a fatty acid, which is another way that we help minimize inflammation. That cetyl M will congregate in the joint and then will help to reduce the amount of inflammation that's in that joint. There's been a lot of studies that show its natural anti-inflammatory effects. Again, we're loading with the building blocks, but we're also trying to minimize inflammation as we also make sure that we've done a full dietary consultation.
As a consumer, when we're looking at these supplements, how can we, weed out the good and the bad? What should I be looking at, on a label or from a supplement perspective to make sure that it's actually formulated the way it should be, that it's dosage the way it should be? What should I look for, and what are like red flags to avoid?
Yeah, that's another great question. I think trust in a brand is probably the first thing that you need to look at. So who's behind the brand? Where do they manufacture? How do they manufacture? There are just so many charlatans that are out there that we recognize as veterinarians, that people go into feed stores and they're inundated with choices, and it's very difficult to look at that package and to know and trust what's in it. And so I think, the first thing is that you just need to trust the brand. I think when you become more educated about what's actually in the products, I think the next thing is to consider is, okay, are we just dealing with building blocks? Are we dealing with a multimodal approach to joint health? And any product that's just providing building blocks is probably not going to have a tremendous effect on that horse. It is rare that an athlete is not receiving a nutrition plan that is deficient in the building blocks that are crucial for maintaining joint health. While we can provide an extra benefit to the joint, those building blocks are rarely the most critical part of supplementing a horse with joint health issues or trying to preserve joint health. I think that having that multimodal would include not only the building blocks, but also as many ways as we can specifically minimize joint inflammation as possible. And again, that's going to happen sometimes locally with things like cetyl M and boswellia, but I think that can also happen by working with that gut joint axis and really trying to minimize the inflammation by the utilization of a postbiotic in there as well. So people need to trust the brand. Then they need to make sure that it's a multimodal approach, not just a building block approach. Then after that, you really want to compare the actual amounts in there. In the industry, we call it label dressing. Someone may put a tiny amount of hyaluronic acid in something and say, and this has joint health benefits because it has hyaluronic acid. And you go and you actually look at that. It may be a very poor source of hyaluronic acid. It may be in just such an unmeaningful concentration that's in there that there's just really no hope that you're going to get a response from feeding that. It's just label dressing. So make sure that they're putting enough of these quality ingredients into the product as well.
Sometimes we'll see on the label things like proprietary blend of probiotics or proprietary blend of joint support products or something like that. And sometimes the doses aren't clearly called out. So within that proprietary blend, what is the dose of each component of that blend? And what are the individual ingredient components of that blend? Those don't get called out. And so if you can't see the dose, you can't really judge the product as being a good one. So if it doesn't pass those sniff tests, or if it's a really tiny scoop and it's got 100 ingredients in it, you can feel pretty sure that for a 1,000 to 1,200 pound horse, it's it's probably label dressing. So utilizing just that good sense that most horse people have to be able to judge the product quickly, and then be aggressive about looking at labels against one another. Take our product and compare the amount of each of the individual Lego building blocks that are in there, as well as the ancillary support products, as well as the postbiotic. Take those amounts, those concentrations, and compare those to other products. I think that's a really important thing, in addition to, do you trust the brand? And more importantly, do you trust the people behind the brand?
I love that. That clears it up on the consumer side, just being able to trust the brand, and also doing our own sniff tests, our own researching common sense to hold things side by side and, compare on our own, because that is, our job as horse owners to make, educated decisions. And so I love that, 4-6's equine supplements is always veterinary formulated, or, vet level dosages, and exactly what you're getting, and you can trust the brand. Anyone, they can go to the 4-6's equine supplements website, and there's tons of videos, there's blog information, there's information on each product, and just from our products to educational resource, there's a ton of knowledge on the website. So that's where you can go to learn more about the joint health supplement and our full line of supplements. Thank you guys so much for talking all things joint health. We have a lot of questions about joint health always.